Hi guys, welcome back. So for today's video, we're going to continue with the first aid series. So today I want to talk about some more of the medical emergencies as well as the injury emergencies that we might encounter outside of the hospital, as well as discuss the steps and actions that we need to do to deal with these life-threatening situations in case we encounter them. So firstly, we need to talk about opioid-related life-threatening emergencies. So opioids are compounds that are extracted from poppy seeds or any synthetic analogs that can react with the opioid receptors in our brain. At high doses, opioids can cause CNS and respiratory depression, and when combined with other CNS depressants like alcohol, tranquilizers, sleeping pills, this might lead to respiratory and cardiac arrest. Opioids can be used as medications primarily for pain relief. Examples include methadone, oxycodone, hydrocodone, fentanyl, and morphine. Heroin is an illegal opioid in the US. And we need to bear in mind that although these are used as medications, actually opioid administration contributes to a third of cardiopulmonary arrests inside the hospital. We have this compound called Naloxone, which can reverse the respiratory depressive effects of opioids. It can be given either intramuscularly, intranasally, or via IV. So if you're going to give it intramuscularly, usually it comes in one of these handheld auto-injectors. Or if it's going to be given intranasally, it can be given through this atomizer device. Giving it intranasally might have its benefits because we don't need to use a needle. And this would prevent needle stick injuries. Secondly, any medications given through the nose will be absorbed quickly in the bloodstream. And this is because our nasal cavity has a really large surface area, which is rich in capillaries for fast absorption. If we're going to give naloxone intranasally, the dose is 2 milligrams. If it's going to be given intramuscularly, the dose is 0.4 milligrams. Also, naloxone takes 3 to 5 minutes for its full effect. And the duration of action is shorter than that of most opioids. This is why sometimes additional doses may be necessary to maintain the reversal of the symptoms. So what do we do if we suspect someone having overdosed from opioids, or if we see someone unconscious and people tell us that they suspect that this is an opioid-related life-threatening emergency? So first of all, we need to verify the scene. We need to assess the surroundings because this is going to give us huge clues as to whether or not opioids might have been involved. So you assess the surroundings. So you look for any evidence that this might be due to opioid overdose. So like medication bottles around, any injections or syringes around, needles. For instance, people who inject heroin, they inject it intramuscularly or just beneath the skin, so subcutaneously. So if there are syringes, needles, or medication bottles, then that might point towards opioid overdose. You also need to assess the victim themselves. So you need to look for signs of opioid overdose. So signs include pinpoint pupils, slow respiration rate, because we know that opioids suppress the respiration center in the brain. Also, we can assess their skin. So if their skin shows signs that they've been injecting medications, then that might then again point towards the involvement of opioids in this case. Also, if there are any bystanders, we can just ask them, do you know what happened to this victim? And, just ask them if they know any information as to why the victim fell unconscious. So after verifying the scene, we need to then check for responsiveness. So we check the breathing and the pulse. And then if the patient is unresponsive, then we shout for help. We activate the emergency response system, or we call someone to do this for us, as well as get the AED machine and get the naloxone. If we're alone, what we need to do is to give 2 minutes or 5 cycles of CPR first before going away, activating the emergency response system, getting the AED, as well as getting the naloxone. So once we've delivered CPR and then the naloxone becomes available to us, what we need to do is we need to prepare the naloxone. So it can be given intranasally, as I've described. So intranasally, it's 2 milligrams. Intramuscularly, it's 0.4 milligrams. If you're going to give naloxone intranasally, then you might have to assemble the nasal atomizer device. So it's very simple. You just spray 1/2 of the naloxone up into one nostril and the remaining half on the other nostril. And if there's no improvements in symptoms within 3 to 5 minutes, then you may administer another dose of naloxone. And then after administering the naloxone, you continue with the compressions and rescue breaths as necessary. And you keep doing this until more advanced medical emergency people arrive or the patient regains consciousness. The next medical emergency that we need to be able to deal with is poison emergencies. So poisons are any chemicals that when swallowed or breathed in or gets absorbed through our eyes or through our skin induces sickness or death. So usually when dealing with poison emergencies, we need to contact the poison control center. So their number should be available on like the first aid kit or like in any environment where chemicals are being used, like for example in a chemistry lab. The poison control center would guide us as to how we can best help the victim. They would ask different questions to try and help us. So they would ask like, can we name the poison? If not, then can we describe the poison, the color of it, the smell of it? They're going to ask how old the victim is, how the poison was ingested, when the poison was ingested, how much of it was ingested, and how the victim is doing now. Signs of poisoning include burns or redness around the mouth, the lips, or the skin that's been in contact with that poison, difficulty breathing, also confusion, altered mental state, drowsiness, and even a breath that smells like chemicals. The first thing that we need to do when we encounter this situation is to verify that the scene is safe. So we need to look out for any spillages or any powders that might be poison. And then we look for symbols that might indicate that poison is nearby. If we think that it's unsafe, then we tell all the other people to leave the scene. And if we see multiple victims that are poisoned, then we stay out of that scene. We don't get ourselves in there and become a victim ourselves. But if it's safe to approach the victim that's been poisoned, then what we need to do is we need to activate the emergency response system. We need to get the first aid kit, and we need to get the AED. So what do we need to do when the chemical is either in the victim's eye or skin? So firstly, again, we verify the scene, and then we get the first aid kit or ask someone to get the first aid kit for us. We put on our PPE, very important in this specific situation because we don't want to get poisoned ourselves. And then what we need to do with gloved hands, we need to help the victim remove any contaminated clothing or jewelry. And we escort them to like a shower where they could rinse the area off, the affected area off. So we need to rinse, for example, the chemical burn poison is here. We need to rinse that area off for at least 20 minutes. With lots of running water. If the chemical is in someone's eye, then what we need to do is we need to help the victim get safely to an eye wash station. So if, for example, there's the affected eye is only on one eye. So for example, this is where I got chemicals in. Then when I rinse it under the tap, this has to go lower. So the water's going like this. And the reason for that is to eliminate the risk of rinsing the chemicals off into your healthy eye, into the affected eye. So if I do this, then when water runs like that, then I might rinse the chemical off this eye and into this eye. So we need to make sure that the affected eye always goes lower when we're rinsing it in the eye wash station. The next medical emergency is internal bleeding. So internal bleeds happen inside the body, so it would be really difficult for us to estimate how much blood the victim has lost. Sometimes we may see signs of bruising, but sometimes we can't really see any signs at all. So we may suspect internal bleeding when a victim, for example, is involved in a car crash accident. So either the person is inside the car that's crashed, or they've been hit by a car. Also, if the victim has fallen from a distance, like a height that is higher than his own height. We can also suspect internal bleeding if someone has a traumatic injury into the chest or the abdomen. Internal bleeding can happen from sporting injuries, if someone slams against another person or something, or if they get hit by a ball that was with great force and is traveling at like a really fast speed. Also, if the victim is coughing up blood or vomiting blood after an injury, if there's any gunshot or knife wounds in the victim, and if there are any signs of shock without any visible external bleeds. What do we need to do if we suspect someone with an internal bleed? Firstly, we need to check that the scene is safe. We need to get the AED, the first aid kit, and activate the emergency response system. Or if there's another person, then we can get them to do all of these. And then after that, what we need to do is we need to help the victim lie down and encourage them to stay still while we wait for the medical services to arrive. And we need to check for any signs of shock. And we need to deliver CPR, rescue breaths, or defibrillation if necessary. We also need to be able to deal with head, neck, and spine injuries. So we need to suspect head, neck, and spine injuries if someone has been involved in a car crash, so either sitting inside the car that's crashed or if they've been hit by a car. This also applies for motorbikes. So, for example, if someone has been involved in a motorbike accident, or if they weren't, especially if they're not wearing any helmet when the accident happened, or if at the scene of the accident their helmet is broken. We also need to suspect this kind of injuries from sporting injuries. So if the victim slams against someone or something. Finally, if the victim falls from a great height that's more than the height of the victim, then we need to suspect such injuries. So signs of these kind of injuries include the patient not responding, only moaning, they might vomit, they might have seizures, they might have problems with their vision, problems moving parts of their bodies, acting very sleepy, and even confused. If the victim shows these signs of head, neck, and spine injury, then they need to be evaluated by a healthcare provider ASAP. And they shouldn't drive or operate any heavy machinery or even drive like a motorbike unless the healthcare provider says that it's okay to do so. Also, we need to be really cautious with how we move the victim if we see signs that they have such injuries. So we need to rule out concussion, which is a type of a head injury. So this happens if the person falls from a great distance, or from sporting injuries, or from any motor vehicle accidents. So this happens when the person's head or body gets hit really, really hard to the point where their brain kind of moves inside the skull. Signs include feeling stunned, headaches, confusion, nausea, and vomiting, feeling very dizzy, unsteady on their feet, difficulty in balance, having double vision or seeing flashing lights, as well as loss of memory. Signs of spinal injuries include tingling or weakness in the extremities. Also, pain or tenderness in the back and neck area, as well as the patient seeming intoxicated or not being fully alert. So if we suspect that the victim has any head, neck, or spinal injuries, then we do not move them. We only move them in case we need to turn them around so they are facing up so that we can give them CPR. If we need to move them out of danger, and if we need to reposition them due to problems in breathing, like if the person can't breathe in that position, or if it's compromising their airway, then we may move them, but really, really carefully. Or if they're vomiting fluids in their mouth, because this might put them at risk of aspiration and of swallowing that vomit. So what do we need to do when we see a victim with spinal, head, or neck injuries? So firstly, we need to verify the scene. We need to get the first aid kit, the AED, and activate the emergency response system, or get someone else to do these for us if someone else is there with you. And then we put our PPE on if there's any, and we address any external bleeding that we can see. And we just encourage the victim to stay still and not move while we wait for the emergency medical services to arrive. And we just monitor their situation and be prepared to give high quality CPR in case they become unconscious. The next type of emergency that we need to be able to deal with is broken bones and sprains. So there's really no way to like distinguish if it's a sprain or a broken bone unless we get the person an x-ray, or if their bone is actually protruding out of the skin, then we would know that it's a broken bone. So signs of broken bones may include swelling in the area, and the victim would be in lots and lots of pain. Also, the victim might tell you that he or she heard like a snap or a pop when the injury happened, or the victim would tell you that he or she can hear like grinding noises every time that part is being moved. So what do we need to do if we suspect someone having either a sprain or a broken bone? So firstly, what we need to do is we need to verify that the scene is safe. And then we need to get the first aid kit and apply PPE if we have any. We only call the emergency response services if we see a very large wound, or if the injured area is abnormally bent, or if we're unsure of what to do. So once we've activated the emergency response system, if we had to, then what we can do is we can cover any open wounds that we can see, or control any external bleeding that we can see. If the area is swollen, we can also place a bag containing ice and water wrapped in a clean towel onto the site of injury. If we suspect any broken bones, what we can do is splinting. So splinting keeps the injured body part from moving. So if the broken bone comes through the skin, then what we need to do is to cover the protruding area with a clean dressing, and then we need to apply the splint. And if the area looks abnormally bent, then we don't straighten it, we just leave it like that, and then we put the splint. So what do we need to do when we see someone with a broken bone and we need to apply splint? So first of all, what we need to do is to verify the scene, and then we need to get the first aid kit, call for the emergency response system, or ask someone else to do these if someone else is around. And then we apply the PPE if we have any. And then what we need to do is we need to look for any objects that we can use as a splint. So for example, we could use like rolled up towels, or even, magazines, or a piece of wood. The only thing that you need to remember is that the splint has to be longer than the injury. For example, if the injured area is my arm, so if this is the injured limb, if the broken bone is right there, the splint has to be longer than my arm. Like I said, we could use magazines, or rolled up towels, or a piece of wood as a splint. But we need to bear in mind that if we're using a hard material as our splint, so for example, if we're using a piece of wood, we just need to keep in mind that we need to pad it with something soft, like, the victim's clothing or rolled up towels, just to make it more comfortable for the victim. So once we've found the appropriate material to be used as a splint, what we need to do is we need to tie our splint to the injured area. So if I'm just gonna use this. So this is not appropriate because it's not longer than the injured area. But for example, if this is my splint, what I need to do is I need to tie this using either like a piece of cloth or gauze or tape it around the injured limb, just to hold that limb securely while we wait for the emergency medical services. So it should fit snugly, but it shouldn't cut off the circulation of the victim. So the next type of emergencies that we need to be able to deal with are electrical emergencies. So electricity can cause burns on the skin or the outer surface, and it can also harm our organs inside. Also, electricity can make the victim stop breathing or introduce some abnormal arrhythmias in the heart, which can then lead to cardiac arrest. Electricity can travel from a power source through the victim and then to you. So do not touch the victim unless they are disconnected from the source of electricity. Or the best thing is you turn off the source if you're trained to do so and if it's safe to do so. So what we need to do is we need to verify the scene. We need to get our AED, first aid kit, and activate the emergency response system. And if there's someone else around, then get them to do this. And then we only approach the victim if it's safe to do so. So if the power source is off and if they are disconnected from the source of electricity. And then if they are, we need to check for their pulse and their breathing and act accordingly. Now let's talk about heat-related injuries. So firstly, we have dehydration. So dehydration happens when the person loses a lot of water through prolonged exposure to heat, or exercising too much, or if they're vomiting a lot or having diarrhea, or they've just not have enough fluids. The thing about dehydration is that if we don't attend to the victim rapidly, if we don't do anything quickly, then this might lead to shock. So signs of dehydration include dizziness, dry mouth, thirst, decrease in urine output, confusion, as well as weakness. The best first aid action is prevention. So if we see these signs, we just need to encourage the victim to drink lots of fluids so that it doesn't lead to shock. The next heat-related emergency are heat cramps. So heat cramps are just painful muscle spasms. They usually occur in the arm region, calves, or the stomach. Signs of heat cramps include sweating, headaches, and obviously muscle cramps. What do we do when someone is having heat cramps? So firstly, what we need to do is we need to verify the scene. We need to get the first aid kit or ask someone to get the first aid kit for us. And then we just encourage the victim to cool off and to drink something containing sugar or electrolytes like orange juice or any sporting drinks. Or if we don't have any of these, just drinking cool water would help. You can also apply a bag of ice and water wrapped in a clean towel onto the areas where they're having cramps. The next heat-related emergency is heat exhaustion. So heat exhaustion has very similar symptoms to that of heat stroke. Symptoms include nausea and vomiting, dizziness, muscle cramps, feeling faint or fatigued, as well as heavy sweating. What do we do when someone has heat exhaustion? So firstly, we need to verify the scene. We need to get the first aid kit. And then we need to just make sure that the victim cools off. So we remove as much clothing from the victim as possible. And we spray them with cool water if a water spray is available. If not, then we could just use clothes and submerge that into cool water and put that on the patient's neck, head, or groin to cool them off. And if they can drink, we could give them something that has sugar and electrolytes, so like orange juice or a sports drink, for example. If we don't have these, then just water would do. And finally, probably the most severe heat-related injury is heat stroke. So heat stroke is life-threatening. It can actually damage organs if not attended to promptly. So this happens due to the prolonged exposure of our body to heat, or doing strenuous activities for a long time under high temperatures. So signs include feeling faint or fatigued, dizziness, confusion, and muscle cramps as well, and even seizures. So what we need to do when someone has a heat stroke is that firstly we need to verify the scene. We need to get our AED, first aid kit, and activate the emergency response system. And then we need to place the victim in cool water up to his neck if possible, or we do the cool water spray if we have that. And then we monitor the patient's condition until emergency medical services arrive. We need to be prepared to deliver high quality CPR in case our victim becomes unresponsive. Finally, let's discuss cold-related injuries. So we have frostbite and we have hypothermia. We know that frostbite is common when it's snowing outside, when it's really icy and the temperatures are really low. But this can also happen in environment indoors. So for example, If someone gets in contact with really cold materials, so like really cold gases, especially without wearing gloves. Signs of frostbite include changes in the skin color. So the skin would be white or grayish yellow. It would look waxy. It will be cold and numb, and the skin will be very hard and it will not move when you push it. So what we need to do is we need to verify that the scene is safe, and we need to get our first aid kit or send someone else to do this. And we need to help the victim remove any tight clothing or jewelry around the area that's been frostbitten. We need to be careful not to rub the area, because this would just induce more damage. If the victim is wet, we need to dry the victim, and we need to put dry clothes on the victim or a blanket to cover the victim and to keep the victim warm. And finally, hypothermia. Hypothermia happens due to the prolonged exposure to cold, or like in pouring rain or any cold and wet environment. Signs include the skin would be cool to touch, or if the hypothermia is really severe, it might even feel icy cold and it might turn blue. Other signs include shivering, confusion, altered mental state, personality change, sleepiness, lack of concern about the condition, as well as stiff and rigid muscles. So what we need to do is we need to verify that the scene is safe. We need to get our first aid kit or AED, and we need to activate emergency response system. And if there's another person, then we could ask that person to do all of this for us. And then we need to get that person out of that cold environment. We need to help the person to remove any wet clothing and help them get changed to dry clothes. If the victim is wet himself, then we need to wipe the victim till he's dry before we apply dry clothes. And we need to cover the victim with a blanket or even newspaper, just anything to keep the victim warm. We stay with the victim until the emergency medical services arrive, and we need to be prepared in case the victim becomes unconscious to deliver high quality CPR.